talk about lasers and the wow experience. Now, what do you mean by the wow experience? The wow experience is where the patient walks into your office with an acute or an inflammatory condition, whether it's plantar fasciitis, capsulitis, bursitis, tendinitis, as long as it's inflammatory and pain. So you want the patient to walk in. You want them to walk out with no pain that day. Now, I'm going to give you an example today of a patient that was treated. We'll call him Gary D. Many years ago, I treated him just to show you the efficacy of class 4 lasers. It was definitely a medial lateral component inflammatory condition, probably a capsulitis or a tendinitis. It's been at least 5 years ago. So anyway, I treated him, very high powered, 10 watts, between 20 and 25 watts, which is almost 2,000 joules per minute. And he got amazing relief. So anyway, he approached me 2 weeks ago. He's a friend of mine, and he's still working out with his black belt, kicking bags, etc. And he asked me, did I know a podiatrist I could refer him to, because I don't see patients anymore. So anyway, I said, hey, Gary, I haven't seen you in a while. I'll bring my little 4-pound Remy over. So whenever it is office, he's a financial planner. And I sat down, looked at it, and he told me the story, and he had his clinical presentation was mild swelling over the second MPJ joint, approximately 1 month. He had taken anti-inflammatories, I believe, but he taped it, soaked it, etc. And he had a hammer toe deformity in the second ray, rigid, or it may have been semi-rigid. And so I treated him. I said, Gary, we'll get rid of the pain. And he got almost no relief, very little relief. And then the second time I went back and I said to him, Gary, let me evaluate this a little bit closer. I did examine it and make sure there was no stress fracture. This is all clinical examination. And there was some decreased pain on palpation. On palpation prior to that and this most recent examination, which is approximately a week ago, there was MPJ pain right over it. And there was no signs of ecchymosis, no neurological, neurovascular status was abnormal. I mean, it was pretty clear that it was a traumatically induced and possibly secondary to the to the hammer toe deformity, which exacerbated it. He does recall striking his weight bag, and that could have possibly started. So I looked at him. I did a gait analysis, a full range of motion. I told him we may need imaging because I was always concerned about a stress fracture, but there was no pain at the metaphyseal area of the severe deep palpatiness. So this time I treated him. I examined him. He had some Achilles Aquinas compared to the right, and I retreated him and also retreated the Achilles Aquinas and got significant amount of improved range of motion. This time, after I treated him, he felt really good. The first time he felt really good, but this time he got complete relief. Now, it could have been the fact that it was the second treatment. Accumulation of laser therapy and photobiostimulation can accelerate the healing. However, my impression was that you need to do a biomechanical evaluation, a neurological evaluation. I did treat his posterior tibial tarsal area as well. There could be neuritis going on, plantar neuritis, capsulitis. You've got to look at these conditions from a complete biomechanical, musculoskeletal, neurological, vascular, range of motion, and contributing factors with him. By the way, his knee was not hurting him, and it hasn't hurt him for over 3 years, and it was a post-surgical failure. But my point is that in order to get the wow experience, you need to put the proper dosage into the area, and you have to have the proper diagnosis and all contributing factors. And the foot, a lot of times it's Achilles Aquinas. It could be a nerve inflammation. When in doubt, and you're not sure if there's a nerve involvement, follow the nerves that go to the, in this case, it could be the second MPJ joint. You do have plantar nerves. Treat the tarsal tunnel. get a sympathetic response by using the laser when you treat the posterior tibial nerve. You can get the wow experience with the proper laser, and the REMI has many variable treatments, has lots of power. It has a peak power of 30 watts, an average power of 20 watts max, and that you have to have the proper diagnosis. Take your time. This is not physical therapy, it's physical medicine.